Hello, hello. My name is Jones, and today we are looking at the surgical condition amputation. Okay, so amputation is one of those conditions that we discuss in surgery one. Okay, so today we are going to look at different uh, things or nursing aspects that we are going to that we have to appreciate about amputation. Okay, just a bit of introduction. We can say amputation is a removal of a body part, usually an extremity. So we remove a body part, and mostly it is an extremity that we are removing. So we call that amputation. Okay, so I'm going to still explain nicely what amputation is, but for now, we need to know that amputation, we're just looking at the removal of a body part, and it usually refers to an extremity. Okay, an extremity that is a part away from the central part of our body. So that is the extremity part that is being removed. Okay, we are not saying internal organs, when you remove its amputation, but we are saying the removal of a body part, and the body part is an extremity. So that removal of that body part, we call it amputation. So amputation of lower extremity is often made necessary by progressive vascular disease. When I'm saying vascular disease, I mean diseases that affects the blood flow. Okay, vasculature that affects the blood flow. So any blood flow that is affected to extremity may lead to undernutrition to the part that is supposed to be supplied with blood. In blood, there is oxygen. In blood, there are nutrients. So that part is going to have hypoxia, less oxygen going to it, and also is going to have less nutrition, and that will bring about a necrosis. So if you have a necrotic extremity part, it will affect the rest part of the body. So it has to be excised. It has to be removed. So progressive peripheral vascular diseases, okay, these are often seen as a sequel in diabetic mellitus. Okay, people with diabetes mellitus tend to have blood which is thicker because of high glucose level. Hence, it becomes difficult for blood to flow in capillaries. Okay, there will be stagnation, leading to hypoxia to the peripheries. So this is what now brings in a problem in circulation because someone has got high blood pressure. Other conditions are fulminating gas gangrene. These also causes necrosis of extremity parts, leading to the whole extremity becoming gangrenous or necrotic. Hence, to prevent the rest part of the body from becoming necrotic or gangrenous, then the decision to remove or the decision of amputation may be made. Trauma is also one of the things that may cause or bring about amputation. So there can be crushing injuries that are irreparable by surgical means. So that will lead to amputation. Frostbite in cold areas, extreme cold. Okay, when the skin is exposed to extreme cold, and here necessarily the feet, as a defense mechanism, blood tends to flow within the inner vessels, hence reducing the amount of blood that is supplied to the periphery. When that happens, then these areas which are not receiving oxygen or that are not receiving blood will not receive oxygen and will not receive the needed nutrients. So that part will go under necrosis. So frostbite and also electrical burns. So, of all these causes, peripheral vascular disease account for most amputation of lower extremities. So now, to begin this lesson, the main objective of this lesson is that at the end of this lesson, you should be able to acquire the knowledge and understanding of amputation and also apply the knowledge acquired in nursing management of a client within amputation. Then the specific objectives are that you should be able to define amputation, you should be able to state indications for amputation, state the types of amputation, mention the levels of amputation, describe the pre and post operative management of clients with amputation, and also state the complications of amputation. So we are going to go by Whereas 2005's definition of amputation. Amputation is the partial or complete surgical removal of a part of the body through one or more bones, such as a limb. Whaler looks at amputation as either partial or complete surgical removal of a part of the body. Of course, him makes emphasis that is through one or more bones. Okay, that is of the limb, and that is his definition that we can still go about. But in our definition, in our introductory notes, we are saying a removal of part of the body, and mostly and we are looking at the extremity part of the body. Okay, so in Weller's definition, we are looking at either partial or complete removal of that part of the body through one or more bones, okay, such as a limb. Okay, so with the definition part uh, done, we can now appreciate some indications for amputation. So, as earlier mentioned in the introduction, diabetes mellitus will cause peripheral vascular disease that may lead to ischemia and hypoxia. Okay, ischemia, less blood flow to the periphery. Okay, and when there's less blood flow, there's reduced oxygen to tissues. So, reduced oxygen supply, hypoxia. So the first one, the indication is diabetic gangrenous foot. Then the second one is malignant bone tumors. Okay, osteosarcoma, that is a cancer of the bone. Osteo to do with the bone, sarcoma, cancer. So malignant bone tumors. So to prevent the spread of the cancer, that part of the limb that is malignant will be amputated. So we don't want the cancer to spread to the rest of the leg or rest of the body. So we remove that part. Okay. Then the third indication is a severe or crushed injuries of limbs. This can be seen after road traffic accidents or other types of accidents. So when there's a crash injury, it becomes very difficult to do repair. So in such instances, amputation may be the best choice of treatment. Then the fourth indication is congenital abnormalities, such as polydactyly. Okay, for those that are born with extra digits, you may tend to amputate the 60th digit. Most it will be done by tying a cotton, okay, that is to the roots of the 60th finger, so that you reduce blood flow to the extremity part of the 60th finger, and then it will fall on its own. Okay, so that is in polydactyly. Okay, so we see that in congenital abnormalities. Then the other indication that we can talk of is severe bone infection, such as osteomyelitis. So in this severe infection, we don't want the infection to spread to the rest part of the body, so we may have to go for amputation. The 60th, indication or reason for amputation would be peripheral vascular diseases. We have numerous vascular diseases that may come through and affect blood circulation. Okay, and if one has got a blood circulation problem, it may lead to gangrene. Okay, it may lead to atherosclerosis. Hence, amputation may become the choice of treatment. Then severe bends. If one, for instance, suffers full thickness bend of the limb, you may have to remove that limb because After full thickness, it becomes difficult for proper healing to happen. Full thickness, the bone is involved. The bone has also been bent. Muscle has been bent. So you might just need to cut off that part which has been bent. So in severe bends. Okay, the eighth indication for amputation is um, handicapping deformities, such as Guerin-Barre syndrome. Okay, this is an acute autoimmune disorder of the peripheral nervous system that is characterized by varying degree of motor weaknesses and the paralysis. Okay, we see also in poliomyelitis where amputation can be done for reconstructive purposes. Okay, so with that discussed, let us now look at types of amputation. So there are basically two types of amputation. So the first one is surgical amputation. Okay, so surgical amputation. Then the second one is a traumatic amputation. So the one after surgery, surgical. The one after trauma or traumatic injury, we're calling it traumatic amputation. So surgical amputation, also referred to as elective amputation, it may range from removal of parts of a digit to nearly half of the entire body. It is performed using two methods. So these are methods in which a surgical amputation can be done. So there is open methods or the guillotine methods. So the wound remains open and drains or allows drainage of exudate until infection or gas gangrene has cleared. So the open method here, we want infection, okay, to finish before we can seal the amputated part. So that is the open method. The wound will be sutured at a later stage and it is used for clients who are likely to develop post-operative wound infection. Okay, then we have another okay, this is just an illustration of the open method or guillotine method. So you can see that the skin is a little bit infected there. So we want this infection to clear. Sorry, okay, the sensitive nature of the picture that we are using for demonstration. Okay, but after the if the wound appears red, then it means there's good sign of healing. If the wound is appearing yellowish, that is a sign of some exudate, and these exudates may affect wound healing. Okay, so that part there will be cleaned with necessary solutions until it shows good sign of healing before this can be closed. Okay, so the second one is the closed method or the flap method. So this is under surgical amputation. So the surgeon will pull the skin flaps over the bone ends and suture them in place. Drains will be left in situ. This is to aid drainage of exudates. It is indicated for clients with less risk of post-operative wound infection. Okay, so those that may not necessarily develop wound infection because of the nature of the accident, there's a clean wound and you have to do surgery, amputation. So for these, you can do the flap method. Okay, so here we have an example of a fresh wound, okay, and the flap method has been used, of course, with a drain, okay, with a drain. The drain is to allow excess blood to come out from the amputated parts in order to prevent exudate formation. So this is an example of the flap method. Okay, the other type of amputation we said is traumatic amputation. A, we said surgical amputation. Now, B, we are saying traumatic amputation. This is done when a body part is severely injured unexpectedly. Okay, so instances where a bone part will be severely injured unexpectedly can be in accidents like road traffic accidents. Okay, so we have a traumatic amputation there, okay, and the traumatic amputation after repair. So accidents may result in traumatic amputation and they can be repaired. Of course, it has to be done within the shortest period of time so that the other part will can also be allowed so that blood vessels can easily form. So if you wait for long, blood vessels may not easily form. The wound, the skin may start getting necrotized. Okay, so now let us look at levels of amputation. These levels of amputation, we can try to appreciate them from the leg parts. Then we can apply almost the similar principle to do with the arm. Okay, so the leg has got the upper part and the lower part, so applies with the arm. So there are about 5 levels at which amputation can be done. Okay, like starting from the thigh, that will be the first level. The, the bone that you find within the thigh is the femur. So that will be called trans, meaning through femoral, okay, amputation. So that is amputation that is done above knee. It passes through the femur. So that is transfemoral or above knee amputation. Okay, so if it passes through the knee, okay, the knee joint, okay, so that is knee amputation, or we can say disarticulation of the knee because it is passing at the knee joint. If it is below the knee, the lower part of the leg, okay, it will pass through the tibia and the fibula. So it's passing through, so transfibula, from fibula, the bone. So transfibular amputation. Okay, so it may also pass through the ankle where there is a joint. So it will be at the ankle. It will be ankle disarticulation. Okay, if you are moving any of the digits there, that is the forefoot there. Okay, so it will be transtarsal because of the tarsal bone, transtarsal disarticulation. Okay, so that is for the leg, we have the tarsals, and then for the hands, we have the carpals. So for the leg, we are saying transtarsal disarticulation. So those are the 5 levels at which amputation can be done on the leg. But otherwise, these other diagrams are just there to help you with illustration to do with the whole part of the body, areas where amputation can be done. Can also be upper limb or shoulder disarticulation. Okay, so all these are types of these are levels of amputation. Okay, so levels of amputation, we look at the position, okay, at which the amputation is done or will be done. So the level at which amputation is done mostly will depend on the extent or the severity of underlying problem. So, as we have discussed, we have the below knee amputation, okay, also called lower extremity amputation. And this one is one of the most commonly performed procedure. Okay, it's easy to rehabilitate the patient with a below knee as they can easily start moving more like as if they don't have even the amputation. So the amputation becomes a little bit easier for below knee amputation. So for below knee amputation, it can also be at the level of toes, ankle, or tibia and fibula, as illustrated in the diagram that we just showed you. Okay, then below knee amputation. Okay, so that is an example there with below knee. Okay, with those bones connecting, and then the tibia fibula, then the stump there. So you can see that that's a below knee. So all you need is to make a prosthesis for the feet. Okay, and then the knee joint movements is retained. So that is the amputation type. Okay, then we have above knee amputation. So above knee is one of those disabling types of amputation, and one undergoing above knee may need replacement of lost limb with prosthesis almost immediately, or it's critical that you find a prosthesis for them almost immediately as you are finishing the procedure. This is to reduce the time of rehabilitation. So there we have a client with above knee amputation. Okay, so we try also to mimic the knee joint in the above knee amputation. Okay, so the diagrams are just there for illustration. So, with that discussed, let us now appreciate the other parts of our objective where we are looking at pre operative care. We also look at post operative care and look at the complications. So, if you are having an elective surgery, like for surgical amputation, okay, the aims would be to adequately prepare clients emotionally and physically for elective amputation, and also to prevent post-operative infection. The environment, okay, for this patient, we are saying they will be admitted in orthopedic wards, okay, orthopedic wards. Ensure the room is clean, and room should be well ventilated. Room should also be the room or the place where you are admitting the patient should be somewhere where you can easily observe the patient, and should be in a well-lit environment for easy observations. Position, okay, remember this is pre-operative, so patient may lie in supine position but can assume any comfortable position to avoid any irritation. Observation, monitor patient's vitals as it helps to detect any deviation from normal. The other things we can talk about observation is that you have to record temperature so that you rule out any infection before patient goes to theater. Okay, check and record pulse and blood pressure. If there is hypertension, okay, you cannot conduct surgery when patient has got the high blood pressure. Okay, if patient has got hypertension, may also compromise the surgery. Take patients for cyanosis to detect impaired tissue diffusion, which may indicate respiratory conditions. The general condition of the patient should also be noted, as whether if the patient is fit to undergo surgery. Psychological care. We need to know that the self-image of the patient will be affected. So patient will also go through some psychological challenges. So in psychological care, you explain the surgery that will be done, okay, and patient needs to understand that it is in the best interest, okay, of they themselves, so that they can recover. This will help the patients to cooperate. Okay, explain even by use of diagram. Like we have put some diagrams within this lesson so that the patient can understand the level at which amputation will be done. This will still help to reduce on the anxiety. Okay, so explain possibility of prosthesis. okay, or walking aid in the rehabilitation phase, as it will also give patients some kind of hope and independence, okay, when they are recovering post-operatively. Involves significant relations for physical and economical support and also emotional support. Okay, so psychological care, other items can be involving the employer of the client if the client works. Okay, this is to help allay anxiety concerning risk for the job. Also, within the psychological care, you can explain, okay, about complications such as phantom limb pain, and that's the one patient that the patient may feel post-operatively, as it will help prevent physical injury from accident falls, and also help patients to manage pain. So, phantom pain, pain that is felt in the limb that has been amputated. You still feel as if that part is still there, but it has been moved because it's still registered in the brain that it is there. So you may even feel scratching that part. So explain to the patient that they may have these feelings. Okay, so you can encourage and or ask the patient to verbalize so that you can allay more of the things that they might be anxious with. Can talk about how the pain will be managed because patients will think that the pain will be too much if the part is removed. So explain that you have some drug cocktails that can help in managing the pain. We can also talk about issues of exercises, okay, because there's a limb or part of the limb that has been moved, so patient needs to know about adaptation exercises that they need to. Of course, to protect the health staff and also patient will also need to sign a consent form. Okay, consent form explains to the patient, okay, the consent form or document will help to protect you legally, okay, so that the procedure is done without any fear of legal implications. Okay, investigations for this procedure, X-ray, rule out respiratory condition, blood HB, rule out anemia, grouping and cross-match in case of blood transfusion. The part of the body that is taken out goes with its amount of blood, so there's risk of anemia. So blood transfusion grouping for possible transfusion is important. Okay, clotting time, blood for clotting time also can be taken. This is to know the clotting profile of the patient and also do a platelet count. Okay, nutrition and fluid therapy, you can give a balanced diet to the patient. Fluid should be given to plants in order to maintain hydration. Exercises for this patient, you can involve physiotherapists to train the patient on how to use walking aids postoperatively. Okay, and patients should show how to use prosthesis in the advanced stage. So you need to prepare patient for these eventualities postoperatively. Hygiene, patient will be given assisted bath, okay, to promote hygiene, and care should be provided to prevent adhesions and promote comfort. The making should be done daily to promote hygiene. Rest and sleep, we can restrict visitors to help patients to rest. Nurse patients in dim light to also promote rest. If patient is too much in pain, administer some analgesia. All this depends on the condition the patient has come with. If patient has come with osteosarcoma, definitely they will be in severe pain. Elimination, provide urinals if patient is bedridden to avoid a soiling linen, and catheterize patient to avoid urine incontinence. On the immediate pre-operative care, okay, as of any other client undergoing operation, you label the clients or give patients a tag, identity tag, by including the limb that will be amputated to avoid risk of amputating the long limb. Pre-operatively, vitals should be taken to act as baseline data. Okay, then prescribed medication like atropine to help dry secretion, okay, intraoperatively can be given. Prophylactic antibiotics also are given to act as um, post-operative infection prevention measure or prophylactic drugs. Escorting patient at theater, this is done in order for the nurse in the ward to give a detailed handover to the theater nurse or the care nurse that is from theater. So throughout, as you are taking the patient, to theater, you as a nurse, you need to be at the headside. This is for easy observation. Okay, so when you reach theater, give a handover. It's important to give the handover, the name, age, where the patient is coming from, and the surgeon responsible for the surgery. Okay, the surgeon that will see the patient. So it is important that all this is done. Okay, so explain disease process during the handover. Okay, and then you also indicate that pre-medication has been given. So in attending to patient relatives, when after you have taken the patient to theater, okay, you need to explain to the relatives and also give them a place where to sit as they wait for the operation to be done. So explain. Making postoperative bed. So this is where you're going to receive the patient. So you need to ensure that the postoperative bed has all the accessories. Okay, oxygen, suction machine, pulsometer, and all the accessories that he needs to be there, drips and the likes. Okay, so now we have talked about pre-operative care. Now we can also talk about points that we need to be aware of in terms of post-operative care. So our aim in post-operative care will to maintain patent airway, maintain adequate circulation, to relieve pain and prevent complications. Okay, so in post-operative care, is collection of clients from theater. When patient is ready, the nurse goes to theater with a post-op tray to collect the patient. The nurse will get the verbal and written handover from the operating theater nurse. Section of theater patient here, we can also ensure that drainages are in situ and are working well. After so any bleeding from the stump should be checked before taking the patient because any active bleeding will show that patient needs to be seen again. They may lose a lot of blood. So blood can only show on the drainage part. So after properly taking the handover from theater, then you have to take the patient to the orthopedic ward where they are coming from. Okay, the immediate environment will be the emergency bay. Okay, here the is going to nurse the patient in a special bed for patient with amputation, and that is a divided bed. Divided bed is made for easy observation of the stump. Okay, so on the divided bed you use a cradle. Okay, this is to reduce the weight of the on the stump, which can exacerbate the pain. Position here the patient is next in lateral position to promote drainage of secretion, and patient should be turned at least hourly to avoid pressure sores. Maintaining of a patent airway, the next patient, you can nest this patient in a lateral position. This will promote free drainage of secretion, thereby promoting patent airway. Suction the secretion or excretion from the patient, it will help maintain a patent airway. Encourage patient to take a deep breath in and out. It will also help maintain a patent airway. Okay, ask for other major operations in terms of maintaining adequate circulations. Here, observe for stamp for hemorrhage, observe linen under stamp for soiling of blood, and that can be indication of hemorrhage. Give fluid as prescribed, such as normal saline, to promote normal blood volume. Okay, observations, temperature, pulse, respiration, and also observation of the drainage is quite important. Okay, so you need to monitor the patient's vitals. So when the patient is just coming from theater, there's quarter hourly observation in the first hour, then there's half hourly in the second hour, hourly in the third and fourth hour. Okay, then when you have now that patient is out of danger, you can go to the non-routine observation. Observe signs of pain. This is for you to do take appropriate measure in order to reduce the pain. Okay, so with pain management, we are going to use narcotics that are going to help reduce the pain. Avoid unnecessary frequent change of dressing will also bring about reduced pain sensation by the patient. Okay, handle the wound gently and position patient to avoid unnecessary irrigation. So, bed cradle over the amputee's limb to lift weight of linen on the stump. On care of the stump, the next, okay, the next needs to ensure that the affected limb, okay, is covered with some sandbags to prevent external rotation and abduction. On contractures, you can elevate the limb with a small pillow to reduce swelling and promote comfort. Okay, other things to do with care of the stump, you can use bed cradle, observe stump, and select dressing. Subsequent care here will concern care of the stump. As for immediate post-op care plus, you would do dressing using aseptic technique, dressing with saline before removing it to minimize pain trauma. Okay, you can use bandage, assess limb circulation, And if patient complains of intense wound, discomfort, or throbbing, you can reel up the bandage to avoid ischemia. Okay, so post-operative pain management, we have mentioned some drugs, prevention of infection, clean or aseptic techniques when dressing the patient, administer prescribing antibiotics also prevent infections, changing of sword linen will prevent infections. Post-operatively, exercises are also important, and you can involve the physiotherapist to teach patients appropriate passive exercises to strengthen muscles. So you can advise clients to avoid weight bearing on the amputations, linked to avoid accidental falls. So patients should not gain too much weight because they will become gain too much weight on the prosthesis. Okay, so it is weight bearing and it means you have to change the prosthesis. So gaining weight too much also may mean changing the prosthesis. Okay, those can also inform patient on the updates to do with the investigations that were done is to help the patient to have confidence in what was being done and the outcomes. Okay, so other things encourage clients to ask questions about the condition and provide clients with the information. Okay, so with that, then on that, give a balance that such as green leafy vegetables to promote erythropoiesis. On rehabilitation of this patient, okay, when we say rehabilitation, we're looking at the process of restoring a patient with the amputation to his previous life as close as possible in order to allow for maximum independence. So rehabilitation will restore the health of the patient, okay, to previous normal life so that a patient can feel independent. Okay, so exercises early rehabilitation is very critical in order to promote quick healing of the stump and involve therapist. On walking, the patient can use elastic bandage to dress the stump to facilitate conical shaping in order to fit well in the artificial limb. Advice depends on type of job suitable for his condition, and if you was an athlete, okay, you can be advised to open a shop for sports attire to earn a living. To do with complications, contractures, these are caused by positioning and protective friction with the jaw pain associated with pain and muscle imbalance. Okay, on deep brain thrombosis, because of affected blood, deep brain thrombosis, which may come because patients may stay for a long time in bed.